Today's topic is really one of my favorite. In order to let you understand it better, I'm gonna use two items, a shoe bag and an orange. Going towards the end of the pregnancy, your healthcare provider is highly likely to ask you to do an internal examination. What we really check with that? One of the most questions I get asked from you mamas when I do an internal examination is, am I dilated? How many centimeters am I? While you probably think that that's the only parameter that we look for when we do an internal examination, most of the cases it's probably one of the least parameter we go looking for. And I want you to really educate you in this video to let you understand how many things there are to consider when we do an internal examination, and also give you some tips to let you cope a little bit better with the exam. When doctors or midwives do an internal examination and you're not in labor, they're probably going to do the what's called Bishop score. The Bishop score has been invented over 50 years ago, and since then has been widely used to understand how the cervix is preparing for labor and how soon these will happen. This is likely to happen. Now, the higher the score, the more likely labor is to start soon. I'm gonna tell you why. The Bishop score looks first of all to the position of the cervix, and this is divided in posterior, mid position, or anterior. Basically, if we think about the anatomy of the uterus and the cervix, so the uterus is like a balloon, imagine it like a balloon, and then there is a cervix, which is a little cylinder at the bottom of the uterus that really keeps the baby nice and tight inside. This cervix is tilted to the back of your vagina towards nearly the rectum, and it really comes forward just when labor starts, okay? So usually pre-labor, a cervix is really posterior and is really far back. Sometimes you can find it in a middle way. Sometimes you can find it straight in front of you when you insert the fingers. The second parameter that the Bishop score measures is the consistency of the cervix. This is divided in firm, medium, or soft. Again, as for the position, a cervix that is nice and strong during pregnancy allows a correct fetal development and a correct fetal growth. So it's normal to find a very firm cervix prior to 37 weeks, because then the labor, the hormones that are involved with labor are gonna change it and modify it, and to get those muscles nice and soft in order for the cervix to ripen and efface. The third parameter that the Bishop score checks is the effacement of the cervix. Now, human cervix is usually 2 to 3 centimeters long, unless you've really done any particular procedures like LEDs or something else to your cervix. This will be the length of your cervix during the course of your life and pre-labor. Now, in order to let baby go through that cervix, the length needs to disappear. So the cervix needs to get effaced, thin, shorten. There are mainly two classifications of this parameter. Some healthcare provider will use the length, so they will tell you your cervix is 1 centimeter long, which means you're halfway kind of, or they're gonna use percentages. Doesn't matter really what way they use. It's nice to hear, to be honest, that there is a change, that the cervix is really becoming thin and soft. The fourth parameter is finally the dilatation. This goes in centimeters, no matter where you are in the world. It always goes from 0 to 10 centimeters. 0 centimeter means the cervix is very close, like I cannot get anything through. 10 centimeter means the hole is quite big enough to let the baby go through. There is really no more cervix left. Now, bear in mind, I'm not talking about the vaginal hole. That's gonna be like from when the baby's crying, it's another different thing. I'm really talking about the cervical hole. So basically the hole that lets baby drop down from the uterus into your vaginal canal. The fifth parameter of the Bishop score is the station of the presenting part, which most of the cases will be your baby's head. This parameter is measured in numbers. It goes from negative to positive numbers. So it will go from -3, -2, -1, 0 station, and then +1, +2, and +3. The more negative the score, the higher is the baby. Again, pre-labor is normal to find the baby out of the pelvis on getting like to the entrance of the pelvis. Towards the labor, we really want the baby to be quite down and engaged in your pelvis in order to have a quicker labor and have an easier second stage of labor, meaning when you actually start to push the baby. Now that we've got an overlook about what do we check during an internal examination, let's talk about some tips that can really improve you the experience and really make you easier to undergo an internal examination. Tip number 1, please don't be ashamed. This is part of our job. We do it all the time. We do so many internal examinations that I don't really look at your vagina. Of course I do look at, to understand where I'm going, but I don't really look at it in the way you think I am. And it's totally normal for us. So please don't be ashamed. Let us know if you do. We'll do our best to make sure you're nice and covered, that your privacy is respected, but please don't be ashamed. Tip number 2, relax. Now, the harder you get tense during an examination, the harder it's gonna be for you, and because the longer it will take me to understand what I really need to achieve from that exam, okay? So again, we know it's like uncomfortable, but it's gonna last 30-45 seconds to the max, and it's gonna be so valuable for us to do and for you to understand where you are with your pregnancy. So please try to be as much relaxed as you can. If there is any reason where you cannot be relaxed, please do let us know before. Doctors or midwives will always ask you for a consent before they do an internal examination, so please do let us know if there is any reason why you cannot relax during this exam. Tip number 3, have your bladder empty. This is very silly. I know you're probably going to pee so much during the end of the pregnancy, but it's just like a silly tip, especially if it's been a long appointment and you empty your bladder before you get in, but now the healthcare provider wants to do an internal examination. Quickly go to pee into wait. Just gonna be such a better feeling. It's gonna be less uncomfortable with the bladder empty. Final tip, especially if that cervix is very posterior. Remember when I was talking about the Bishop score before, if the cervix is far back in the vaginal canal, it's gonna be quite harder for the operator to get in and to get the cervix, okay? So what we really usually get women to do is 2 fists nice and firm and close and put them under the buttocks so that they kind of lifts the pelvis. I'm gonna show you. You put them here, okay? And then this automatically will shift the pelvis from like this to this, and this is gonna automatically bring the cervix forward so that it's easier for us to reach really. So let's put what we have learned so far into practice, okay? This is our uterus. We have to use a little bit of imagination, girls. It's a pregnant uterus, okay? There is a baby inside, and this is our cervix. Remember what I was saying before during the Bishop score explanation? This is like a long cervix. It is closed and it is posterior. So this cervix will probably have a very low Bishop score, but that's okay. That's how we want it to be during pregnancy. We want to have that cervix closed, nice and firm, in order to keep baby in and to let it grow nice and healthy. Towards the end of the pregnancy, you're gonna start to have some Braxton's contractions. The cervix is gonna go through some modification that are gonna get it a little bit softer and a little bit shorter as we go ahead. Now, effacing, ripening that cervix takes forever, okay? Especially for first-time moms, it's really a long process. For some women, it happens like over weeks. Other, they just get it done overnight. It really depends. We can't tell you how long it's gonna be, but don't worry, nature knows what it's doing and it will finish, okay? First-time mothers are unlikely to dilate unless the cervix is effaced, while second-time mothers, third-time mothers, and so on, it's normal to see a little bit of dilatation happening, although the cervix is not fully effaced yet. So if it's your first baby born vaginally, and you've labored before and they tell you that you're like 1 to 2 centimeters, it does not mean you're in labor. It just means like your cervix is open, and that's normal for experienced mothers because the uterus knows what to do and has done it before, and it kind of has a memory in that sense. So it's just gonna get things going a bit quicker, just to have labor starting sooner and to have it shorter really. Cervix is getting shorter and shorter and shorter until to the point when it's really fully effaced, like in this case, okay? So there is no more cervix, there is no more length of the cervix. Okay, so if you are a first time mom or a second time mom, whatever, and you have been having those latent contractions like of the first stage of labor, I'll do another video on the stages of labor, but anyway, if you're having those irregular contractions for the past few days and you go to get checked and the midwife tells you that you're still not dilated, or you are like 1 or 2 fingers, which for us means like 0.5 centimeters, 1 centimeters, but your cervix is fully effaced, or is 50% effaced, or is 1 centimeter long, well, that's the best news you can get, because it means those contractions are working, they are facing your cervix, they are getting nice and soft, and they are having some results on your receptors of the uterus, and everything is just going perfectly. So it's normal to not be dilated in this first days of early contractions, but if the facing is happening, you're on the right way. Labor is proper, active labor is gonna start soon. So now for the exciting part of the labor, dilatation is finally happening, and you finally start to dilate. Okay, so we're gonna have our special baby in here. This is the cervix, is probably like 1 centimeter dilated, and then as those contractions become more regular, more frequent and stronger, the cervix is gonna start to open, and baby's gonna start to come down. Okay, remember, station is also another very important parameter to consider, because you don't want to be 10 centimeters with the baby's head very high, because it's so much harder to push, and even if you're 10 centimeters, it doesn't mean the birth is imminent, you just need time to get that baby down. So we really want to work dilatation and station at the same time. This is our baby, okay? And we also have like an intact bag of water, so means the membranes are intact, they haven't broken yet. Okay, so you can really see this is the contraction with this, can you see? Yeah, with the strength of the contraction, the amniotic sac is gonna get nice and tight, ready to pop. The cervix is gonna keep dilating. Okay, so we can feel so much more of the baby's head. Now, doesn't mean this is not the vagina, okay? Doesn't mean that you can see the baby. I'm really talking about the uterine hole, and then you have the vaginal canal here. When you are at the point where you see that much of the baby's head, baby's gonna be born in the next contraction, like it's crowning. While here, we're just talking about dilatation, okay? We go here with the fingers, okay? And we tell you, oh, fantastic, you're fully effaced, you're like, I don't know, 4 centimeters dilated or something, and the baby is quite down and it's nice engaged and it's nice applied to your cervix. Like for example, there is no gaps in between, like a lot of the baby's head is just pushing towards the cervix, and those are like, this is the best situation in order for your cervix to stretch nice and gently. Now we also have the bag of waters here, can you see it? Okay, so this is another thing that is gonna help your cervix to stretch more gently. Sometimes, you know, because there is this bag of waters, just the cervix just stretch nicely. Sometimes some women, they just need this bag of water to go in order to dilate properly. It's really subjective, okay? So you're here, you're nearly fully dilated, or 10 centimeters, okay? Now, for example, the bag of waters might break at any point at this stage if it hasn't broken already. You might also have what is called a bulging bag of water. So the cervix is quite dilated and you have those bulging waters that are just about to pop, and with the strength of the contraction they're just going to burst at any moment. Or you might just have like waters really well applied to the baby, okay? So at this stage you are nearly ready to go, and there you go, baby's nice and down, your 10 centimeters dilated is at the spine station probably at this stage, or +1, and you're ready to push and to get baby straight in your arms. Another thing that they might ask you, and it might be a reason why they do an internal examination, is to give you a sweep of the membranes, okay? Which is really when your cervix is a little bit open, even like a little bit less, even like 1 finger or 2 fingers they can put inside. They might offer you the membrane sweep, which is really a simple procedure that consists in inserting the finger between the cervix and the baby's head, and just to detach that layer of the membranes, okay? This is likely to release prostaglandin, and it's likely to bring something forward. Now, it really works 1 in 8 times, so you're not gonna go into labor, but for some women it does help to efface the cervix, and for some lucky ones it really does bring labor forward, okay? So that's really what you do when you do a sweep, okay? It is a little bit uncomfortable, but it's quite quick and it might give you a chance to go into labor. Sometimes some women do require even more than one, okay? So it's really subjective. That's all for this video. We're gonna wrap it up here. Me, my uterus, and my baby Orange. I hope it was somehow clear. I hope it's gonna help you to understand the fascinating process of labor a little bit better, and to just let you go through with a little bit better mindset. This is just a process that nature does automatically. Your body and your baby, they know what to do. I know it feels like quite complicated, but it's all gonna happen very nicely and smoothly. You will efface and dilate, and you'll have that baby in your arms very soon, okay? Just trust your body. If you have any questions left, just drop them in the comments down below. Also, I leave a link of another very interesting video done by another childbirth educator, where she uses just like a balloon with a ping pong ball to explain this process. It's very cute as well. But if you have any other problems or any other questions, I also am available. I'm gonna put another link down below where you can contact me and just do some classes with me if you need to, or whatever you need to know about. I'm here for help, okay? See you next video.